Good day, everybody. This lecture that you're going to be watching right now is about Introduction to Joints. You're going to be beginning a series of labs, where you're going to be asked to discover the structure and function of different joints. Why do these certain joints do the jobs they do? This lecture is just to give you a brief introduction into joints. Now, joints are basically any point where two bones come together. So if you got a point where for example, the bones of your ear, when those come together, those are actually joints. And like all joints, they are subject to arthritis as well. But if you've got your phalanges connecting to your metacarpals, well, you've got a joint. Now, joints function to either hold bones together, as you see right here. This would be a good example, like the joints there between the sutures of your skull. You learned about the different sutures of the skull. Well, those are joints that are just basically being, holding bones together for protection. Other joints provide mobility, like your knee, your elbow, and others. Now, joint classification, I've seen lots of anatomy books, and some base their classification as either being functional or structural. Functional is based on joint mobility. So you'd be classifying joints as freely movable, semi-movable, or non-movable, basically. That's kind of a tough one because there's always some overlap between the different kinds of joints when you look at that functional classification. So in this class, we're going to focus on a structural classification. What's holding bones together. And when you look at this, you're going to be dividing the bones or joints into three different kinds of classes. One, fibrous. Joints are held together by fibers. That's pretty simple. But joints can also be held together by cartilage. Those would be cartilaginous joints. And some of what I think are the most interesting joints are the synovial joints. These are joints that are held together with a joint capsule and are surrounded by synovial fluid. So it makes them very movable. Now, connective tissue that holds these bones together, two types that you really need to be aware of for this class. First are tendons. Now, tendons are going to connect muscles to bone. So those bulges on the back of your hand, like you see in this picture right here from the cadaver where the skin's been removed, those bumps you have up there are tendons, and the muscles associated with them are way back up in the forearm. Otherwise, you have ligaments. These are going to attach, these are connective tissue bands that attach bone to bone. In here you have, in this particular one right here, you have the most commonly injured ligament, the anterior cruciate ligament, ACL. You've all heard, I'm sure, of some athlete or maybe a good friend of yours may have tore the ACL. But you've also got bands of cartilage in here, the meniscus. You have the patellar ligament right down here. Those are examples of bone being held to bone. Now, when you come to lab tomorrow, there's three things I really want you to focus at each lab station. First, ask yourself and try to answer this question. As you're looking at the bones of the joint and the models, determine the function. Now, you may have to just simply try to move that arm. So, for example, I say you're at the station of the elbow joint. Well, what's the function of the elbow joint? You may just move your elbow. And it could be something as simple as, hey, it bends and straightens the arm. So look for the function of the joint. What does it do? Second, ask yourself, and then develop an answer here, what structures are present in this joint to allow it to perform its function? So here you're going to be looking at bones and bony processes that are present that would allow the joint to function. And again, going back to the elbow, what's special about the bones that allow the elbow to do all the things that it does? What are the structures on the kneecap and the femur and the tibia that allow the knee to do its job? And don't limit yourself to just bones. Think about ligaments and tendons as well. Finally, ask yourself and look for in the models, What structures are present to prevent unwanted movement? All right, so why doesn't your elbow bend all the way back? As you study that joint, looking at the models and the bones, what things are in there naturally that's going to keep this joint from hyperextending? What's going to keep it from moving sideways? That's what your goal is on the next couple lab stations. And like always, come with questions, and I'll help you work through them. Thank you for your time.